Well, welcome everyone to the final lesson on electrocardiography. And this one, as it seems to say right here, is a review of waves. So in this lesson, this is really going to be a review, something I suspect the vast majority of you know lots about, and that is the P wave, the QRS complex, and the T wave, and basically how that relates to the cardiac cycle. So it'll be a quick review, short and sweet. And at the end, we're going to ask the question a little bit about the QRS complex and that why are there Q waves, R waves, and S waves together. It's one of those things that isn't presented really well all the time in electrocardiography. Not a great pile of clinical application right off the front, but certainly is going to help you understand bundle branch blocks a little better when we get to that. So just as a quick reminder, this is the electrical anatomy of the heart, of course. Up in the right atrium, we have the SA node, the atrioventricular node at the bottom of that atrium, and then the His-Purkinje system, which is that fast conducting electrical system of the heart that helps conduct our QRS complex into the ventricles. I think we've probably seen this lots now. So in a normal sinus rhythm, the beat begins at the SA node and then travels out across the atria, as you see here, causing atrial contraction. And then there's an electrical pause at the AV node. So the AV node is a bit of tissue whose job is specifically not only conduction of the electrical impulse from the SA node, but to cause a little bit of a pause, allowing for the atria to finish contracting and emptying into the ventricles. Next, we get ventricular activation. So the electrical signal is passed along our His-Purkinje system into the ventricles, and we get ventricular contraction. And then finally, repolarization, meaning that there is an active process by which the ventricle not only relaxes, but becomes back to an electrical state where it's ready to basically take another impulse and to fire again. So how does this relate to the waves that we see on our electrocardiogram? Well, I think you know the first step is atrial depolarization, and that, of course, is the P wave on our electrocardiograms. And that pause that we see at the AV node is actually the PR segment. So we talk about that when we talk about intervals a little later on. But basically the atria have contracted and now there's a pause. So that pause is basically that flat line you see on the ECG tracing between the P wave and the QRS complex. So the ventricles, they now fire, and that gives us our QRS complex, as you see here. There is a bit of a time while the ventricles basically contract, and then the T wave is basically a sign of electrical repolarization, meaning the heart getting ready to electrically do another beat. So that's the normal normal set of waves that we see on an ECG, the P wave for the atria, the QRS for ventricular contraction, and the T wave for ventricular repolarization. And really, at this point, this is kind of the must-know part of this lesson, and I suspect pretty much everyone listening to this is going to have run across this before. But the next part is just a little bit of a deep dive into the QRS complex. So if you look at the QRS complex, you might actually wonder, well, I know this is basically ventricular depolarization, but why are there three different waves in some of the leads? So for instance, if you look at lead 2, there's often a small Q wave, an R wave, and an S wave. So why are these three waves all packaged together into ventricular depolarization? And so the answer to that is that ventricular depolarization isn't actually just a one-step phenomenon where the ventricles all just contract at once. And there's actually 4 basic steps to it. So at the start of ventricular depolarization, what we see is depolarization of the intraventricular septum. And that depolarization actually starts on the left-hand side and runs to the right. So you get this left to right depolarization wave that occurs along the septum. And that actually, if you're looking at lead 2, which is what's diagrammed here, goes a little bit towards the negative lead and gives you that small little Q wave that you see in lead 2. As ventricular depolarization continues, basically now the depolarization spreads down the septum and across the base of the heart, and so you get a QRS vector that looks basically what you see here in line number 2. So it goes very much towards the positive electrode of lead 2, and basically gives you this large positive deflection. And as depolarization continues, it continues up the ventricles. And in this case, the left ventricle, of course, has a much more mass than the right, at least in the normal heart. And so the electrical vector starts to swing out a little ways towards the left of the patient, as you see here. This is still heading in the positive direction for lead 2. We're heading towards the positive electrode, although not as much. So you're still going to see positive deflection on the EKG, which you see here. And finally, at the end, there's a little bit of depolarization at the end and tip of the ventricle. And at this point, the electrical vector is now pointing away from the positive lead of lead 2 towards the negative lead. So you're going to get a small S wave at this point, or a negative deflection. So when you look at a QRS complex on an ECG, this is the reason why there are a number of waves built into it. There begins with depolarization of the septum. It then spreads through the base of the septum and base of the heart. It then depolarizes the ventricle with a heavy lean towards the left ventricle in the normal heart. And then finally gets kind of the tips and tops of the ventricle, which swings the electrical axis of your QRS in an upwards direction, often giving you some Q waves in leads like 3 and lead 2. So anyways, this doesn't have a ton of clinical application right off the bat, other than if you wonder why the QRS complexes change depending on the leads you look at. This is why, and that's because the ventricular depolarization is really a series of steps. But if you understand this and you understand these steps of depolarization, then things are going to make a lot more sense for you when we talk about bundle branch blocks in subsequent lessons. Anyways, that's it. Quick and dirty, and a review of some stuff that I think you probably knew already, and some thoughts about the QRS complex that may not change your day to day, but are going to make a difference when we talk about bundle branch blocks down the road. Thanks.